There are some nighttime signs of diabetes that you should be aware of, and it's crucial to understand what your body is trying to communicate. Many people ignore these signs, which can lead to more severe organ damage, especially to the kidneys. The first sign is frequent urination. If someone gets up several times during the night to urinate, this is called nocturia. This happens because there is excess sugar in the blood, and the kidneys try to filter out this sugar. The body attempts to get rid of this excess, as it is toxic. Wherever sugar goes, water follows. So by eliminating the sugar, you also lose fluids, which leads to dehydration. I remember a case in my practice where a man was getting up to urinate up to 10 times a night. This impacted his life because he was exhausted during the day. I explained to him that this symptom was unnecessary, and after following the recommendations, he solved the problem in 3 days and was able to sleep through the night. Another important sign is excessive thirst. When you have diabetes, dehydration is common, so your body feels the need for more water to rehydrate. Additionally, with high sugar levels, the body also tends to retain sodium, making you need even more water. This cycle of drinking a lot of water and excessively urinating causes further dehydration. By eliminating water, the body also loses potassium, magnesium, and calcium, but for some reason, it retains more sodium. Another symptom is restless leg syndrome. I've personally experienced this problem, and it was related to excessive sugar consumption. Sugar depletes an essential vitamin called B1, and when there's a B1 deficiency, the body accumulates lactic acid in the muscles, preventing them from receiving oxygen properly. This makes the muscles very tired, especially during sleep, causing restlessness. Additionally, magnesium deficiency, which is common in people with high sugar levels and high blood pressure, also contributes to this restless feeling, as the muscles can't fully relax. These deficiencies in B1 and magnesium are usually the result of excessive consumption of refined carbohydrates and sugars. Consuming too much sugar can temporarily make you feel better, but unless you eliminate the excess sugar from your body, the symptoms will always return. One of the next symptoms is related to restlessness, such as diabetic neuropathy, which can affect the feet more. This is called peripheral neuropathy, and it can manifest as a burning sensation on the soles of the feet, pain, numbness, or any other strange sensation. These symptoms tend to worsen at night, as lying down causes blood to pool, creating pressure on the damaged nerve endings. The treatment for peripheral neuropathy involves a combination of B-complex vitamins, such as benfotiamine, and alpha lipoic acid, which form a very effective combination. Another related symptom is the occurrence of leg or foot cramps, which happens due to excess sugar in the blood, leading to magnesium deficiency. Without enough magnesium, calcium begins to accumulate in the cells, causing excessive muscle contraction. Magnesium is necessary for muscle relaxation, so when there is an imbalance with too little magnesium and too much calcium in the wrong place, cramps occur. The recommendation is to use magnesium glycinate, which not only helps relax the muscles, but also improves sleep. Another important symptom is excessive sweating at night, especially on the face, neck, or upper body. This should not be confused with night sweats or hot flashes caused by menopause, as it is a different condition. In this case, the person sweats at night without any apparent reason, even if it's not too hot. This happens because high blood sugar levels put the body in a fight or flight state, known as sympathetic dominance, which is the part of the nervous system responsible for alertness and stress. When adrenaline is activated, the body begins to sweat as a form of compensation. This stress can occur both with low blood sugar levels, when the body tries to raise them, and with high blood sugar levels. Another common symptom in people with diabetes is sleep apnea, which occurs when there is an obstruction of the airways at the back of the throat or nasal passages, preventing the person from breathing properly during sleep. This is a classic symptom in people with diabetes and is usually related to excess insulin in the body. Although doctors rarely measure this, it is a problem linked to insulin resistance, which occurs when the body tries to protect itself from the toxic effects of glucose or sugar. Insulin, which controls blood sugar levels, begins to lose its effectiveness, creating resistance, which can contribute to significant weight gain. Insulin is a fat-storing hormone, and the next symptom is related to hypoglycemia, or low blood sugar levels. The body tries to remove excess sugar from the bloodstream by using insulin. As previously mentioned, insulin will be high, causing blood sugar levels to drop. As a result, you may wake up in the middle of the night with hypoglycemia. One of the main problems with this is the activation of adrenaline, which causes you to wake up feeling stressed, along with an increase in hormones such as cortisol, which usually occurs between 2 and 3 a.m. This is precisely when sleep should be the deepest. Additionally, the liver releases sugar in the early morning, which contributes to this spike. To address this, a low-carb diet over a prolonged period, perhaps 6 to 8 months, is essential. Sometimes, the problem is not just the diet, but the liver, which continues to produce sugar after years of poor eating habits. Another related symptom is difficulty falling asleep. High blood sugar levels interfere with melatonin release, and you may lie there waiting for sleep, but it doesn't come easily. Acid reflux is another sign, where you may need to sleep with your head elevated due to acid rising from the stomach to the esophagus. This happens because sugar problems affect the autonomic nervous system, which controls the body's valves, including the one at the top of the stomach. An effective solution is a ketogenic diet with fewer meals, one in the morning and another at lunch. This helps prevent the digestive system from being overloaded at night. Nightmares or vivid dreams can also be a symptom, caused by an imbalance in neurotransmitters due to a vitamin B1 deficiency. Excessive carbohydrate consumption or being diabetic can deplete this vitamin. When my children had nightmares, giving them B1 quickly solved the problem. Another symptom is high blood pressure in the middle of the night. Normally, blood pressure should drop during sleep, a process called nocturnal dipping, but with diabetes, this dip doesn't occur, and blood pressure rises, which may only be noticed as a sense of alertness. Heart palpitations can also occur during sleep, caused by an electrolyte imbalance, such as a deficiency in potassium and magnesium. An electrolyte supplement high in these substances can be very helpful. Teeth grinding at night is another sign, related to the fight or flight state being activated during sleep, causing the jaw muscles to tense. Lastly, morning headaches are common, usually due to dehydration. The brain needs an adequate amount of fluids to function without pain and pressure. It's not just about drinking more water, but also ensuring the intake of proper electrolytes to rehydrate the body. Now that you recognize these signs, the next step is to take action to definitively address the problem.